Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today's special guest, Dr. Erez Dayan, talks about lymphedema, the risk factors, and how to treat it. And now, here's Dr. Rod Rohrich.
Today we're going to talk about a very common problem that we see in medicine called lymphedema. And we're honored to have Dr. Erez Dayan with us, who's a world expert on lymphedema. He's actually written a book about it. We're going to talk a little bit about that. And so tell us, Erez, what is lymphedema? All we know is that most physicians don't know much about it. They're afraid to see those patients because they don't know how to treat it. It's ill-defined. And so tell us a little bit about what is it?
Well, thank you for having me, Dr. Rohrich. Lymphedema is a disease that I actually didn't know much about until I was a general surgery resident about 7 or 8 years ago. And the lymphatic system is essentially a secondary circulatory system. Just like our heart pumps blood, the lymphatic system pumps lymphatic fluid. And it serves a number of different functions. Part of the lymphatic system is an immune function, creating antibodies and circulating them. And the other part of the lymphatic system is just fluid balance. You're pumping blood, and a certain percentage of the fluid comes out of the circulatory system, and the lymphatic system picks up that fluid and recirculates it. So when we get swelling in our extremities...
So it's kind of like the garbage disposal
Exactly.
system.
And many people say that it's basically a waste disposal system. It's the police officer of our circulatory system.
Neat.
And it's a very critical part of everything we do. We just don't think about it much because most of the time it doesn't cause us any trouble.
Right, it's been kind of the stepsister to the blood vessels and the veins
Exactly.
in our body.
We're all very focused on the circulatory system, but the lymphatic system has, any disorder of the lymphatic system has very significant implications.
So tell us about that. When something goes wrong and you get lymphedema, what does that mean, and how does that affect people that are just listening to this?
So in the United States, the most common cause of lymphedema is breast cancer treatment. And the reason for that is when a surgeon comes in to remove breast cancer, oftentimes they sample lymph nodes in the armpit area, the axillary area. And even we've seen that if you take one lymph node just to sample it, which we call a sentinel lymph node biopsy, the chances of getting lymphedema are 5 to 10%, which is quite high. If you look at 12% of women in the United States suffer from breast cancer, and then you look at the patients getting surgery for it, it's a very high number of patients. Radiation, the percentages are very high as well, 30 to 60% of patients
so
get some kind of lymphedema.
So you do the surgery for breast cancer, that's pretty reasonable. And then you irradiate and shut down that waste disposal system.
Right, exactly.
So you got a 15, 20%?
It can be very high. And as a matter of fact, many breast cancer survivors that suffer from lymphedema because of their breast cancer treatment feel that chronicity of the lymphatic disease is almost worse from a quality of life standpoint than their initial breast cancer.
Really, and many times they're not really aware of that or told that by their surgeons, right?
That's right. I mean, the lymphedema as a disease has only become more mainstream in the past 10 years or so. And a large part of that is because now we can visualize the lymphatic system better.
And how do we do that? Tell me about that.
Previously, the way we would look at the lymphatic system would be through radionucleotides. And what that means is you would inject kind of a radioactive material, usually it's called technetium, and then you would come and essentially get an X-ray that would show you where that radioactive material ended up. And that would be the lymphatic system. And that was a very static way of looking at things. It was just one snapshot in time. And now we have more sophisticated imaging. We use what's called indocyanine green, which is basically a fancy word for just a fluorescent dye. And that dye is injected into the skin, and it travels up the lymphatics, and we can watch the lymphatics. So we can actually see where the lymphatic channels are.
Is this with some type of scope?
Yep, exactly. There's a camera with a special lens on it, and it basically shows you how that fluorescent dye travels.
Radiation?
No radiation, exactly. It's a very key. It's a very safe dye.
Is it as accurate or?
I would say more accurate. Most people would say
Really?
much more accurate because it doesn't just show you a snapshot in time.
It's dynamic.
It's dynamic, exactly. And it's been very useful actually to improve safety. There's a breast surgeon named Suzanne Klinberg who has demonstrated using these different tracers to avoid lymph nodes that are important for draining the fluid from an extremity, for example, in breast cancer treatment.
So what should breast cancer patients know and ask their surgeons about this if they have breast cancer? Because if this is such a debilitating problem and they're going to get a mastectomy, what do they need to tell their surgeon?
So I think the most important thing is choosing a surgeon that's aware that lymphedema can be a problem. I think it's very important for surgeons who are treating breast cancer to be aware of it and at least to notify the patients that this is a potential risk. Moreover than that, there are a number of centers across the country and in the world that will include microsurgeons in the actual breast cancer surgery to either reconstruct lymphatic channels prophylactically. It's called the lympha procedure, and they're doing it at Harvard. They're doing it at Memorial Sloan Kettering.
They do it on all patients?
Yes, exactly. So it's trials are still out there to see what the impact of that may be. But you may imagine that if you're doing an excision procedure for breast cancer and potentially damaging lymphatics, it wouldn't hurt to repair them at that time while...
Right, because it's a higher risk, up to 50% potentially.
Exactly, or even higher. And the implications of it are significant. These patients have to wrap their extremities chronically. They can't enjoy their quality of life in terms of gardening. Any kind of scratch can cause a very severe infection leading to multiple admissions.
So why wouldn't you do lymphedema repair surgery?
You can. I mean, the problem really is that there's not a lot of access to those surgeons. It's a pretty specialized area. Those lymphatic channels are very small and very delicate.
In the past, it's been attempted and it didn't work well. So what's changed today, Erez, that makes it better or a higher success rate?
Well, I think two things. I think microsurgery, where you're connecting small vessels, has improved in terms of our skill set, in terms of the imaging, the microscopes. Now, actually, we have microscopes that incorporate the indocyanine green imaging, so you can.
Oh, really?
Yeah.
So you can see them.
Absolutely. Mitaka is a microscope company from Japan that incorporated that indocyanine green, so you can actually see the lymphatic channels, and you can see which ones are damaged during the surgery and repair those at that time.
So help me understand. So if one of your relatives, your mom, had breast cancer, what would you tell her? What would you tell her?
Well, from my perspective, I would have her go to a high volume center first of all that does a lot of these with a surgeon who is skillful in terms of repairing the lymphatics. I would also have her see a big part of lymphedema treatment is a lymphatic therapist. There's a certification for decongestive physiotherapy, and it involves specific massage types to pump the lymphatic fluid.
So have the lymphatic surgery with the mastectomy, then post-operatively do the lymphatic massage?
Yes, absolutely.
Really?
It has very little downside, helps mobilize fluid. And the biggest issue with lymphedema is that fluid that accumulates from the dysfunction of the lymphatics is very protein rich. And because of that, it can become infected very easily.
And gets very indurated and hard.
Correct. It gets indurated. It's actually, in the worst case scenario, that inflammation and induration can lead to cancer in and of itself, called Stewart-Treves, lymphangiosarcoma, which is rare but life-threatening.
So you have this procedure, you have the repair, and then of course, then you undergo radiation therapy. So what happens to that micro repair?
It's a great question. Radiation is sort of the natural enemy of most surgeons. It's it kills cancer cells, but also does a lot of damage to the surrounding tissue. So that's an area that's being actively studied. Most patients, I would say, do not get the lymphatic repair at the time just because it's not widely available. But many patients we see end up coming back after they already have lymphedema.
So they've had their cancer therapy, they've had their radiation, and now they have lymphedema.
Then they've developed lymphedema, correct.
Right.
Usually in the United States, it's an upper extremity lymphedema, but because of breast cancer treatment. But you can get it from GYN cancer treatment.
So how long after? Okay, I have radiation after breast cancer. How long before you know? What are those signs?
So a lot of patients. So first of all, the symptoms of lymphedema and the presentation of it are not always correlated. So you can have mild swelling or moderate swelling on clinical examination, but the patient feels a very heavy extremity that affects their quality of life.
It doesn't even look that swollen.
May not even look that swollen.
Really?
But when you image them using lymphatic imaging, you can really see that there's.
And this is like within months or so after?
It can be within months. There's been reports 2 to 3 years after. There's a lot of question over what exactly the pathophysiology is. Is it an inflammatory system? Babak Marara at Memorial Sloan Kettering has a funded lab specifically looking at this area of inflammatory markers, and lymphedema? Is it an inflammation-based thing? Is it just a simple blockage? What exactly is causing lymphedema?
So these patients come to you, they now have lymphedema, they actually have it manifest, you've diagnosed it. So how do you treat this chronic lymphedema from breast cancer? And it's in the upper extremities.
So lymphedema treatment really depends on the stage. In the early stages, the extremities are fluid-filled. And in the later stages, you get inflammation, scar tissue, and fibrosis.
What does that mean? It's just very hard, right?
Hard,
Painful.
scar tissue, and actually you get less fluid. And we actually did a study looking at MRI images of different stages of lymphedema. And you can actually tell the fluid content, which shows up black on the image, versus the fat content, which shows up white. And you can see as patients progress to more severe lymphedema, which is inevitable without treatment.
So that's that scarred.
Exactly. Scarred, woody, fibrous, tough extremity. Yes, it becomes painful. The skin becomes very thick. You actually get skin changes. And so in those cases, so in the early cases, what needs to be done is called decongestive physiotherapy. That means wrapping the extremity, lymphatic massage, and keeping compression on it.
So non-surgical treatment.
Non-surgical treatment is the standard of care.
And how effective is that? Is that for life?
It's effective. The problem with it is exactly that. It's for life, and it requires daily maintenance. So it's a very cumbersome problem in terms of, for patients that have, active lifestyles, active jobs, very hard to keep up with that. For patients that are not fully treated with standard, non-surgical treatment, there are a number of different physiologic treatment options for lymphedema. And those include what we call lymph node transfer, where you can essentially take lymph nodes from one part of the body and reconnect them to a different part of the body.
That's in these long-term.
Yeah, so that has been done. Some of the pioneers in that area are Corinne Becker in France and Mingwei Chang in Taiwan. And what they've shown is that you can take lymph nodes from the groin area or from the omentum, which is intra-abdominal tissue, and transfer it to areas of lymphedema. And they've shown actually through lymphatic imaging that the lymphedema ends up tracking into those transferred nodes and back into your system.
So how successful is that procedure in these?
So it's been shown to be successful. There's a variety of success rates, but it's something, most people would say something in the range of 60 to 75% on average.
Which is pretty good, since before that chronic indurated edema there was no chance of it improving.
Exactly.
Right?
So those procedures, the physiologic procedures primarily help with patients that have fluid-filled extremities. The ones that have scar tissue and hard tissue benefit from excisional procedures like liposuction, and there's some more drastic operations for patients that are really in late-stage lymphedema, which really involves excision.
Like the modified Miller procedure and
Correct,
things like that.
Correct. There are surgeries where you basically remove all the soft tissue and then skin graft them, debulking procedures, which is rare, but those are mainly in severe cases.
Right. Okay, so that's how acquired surgical lymphedema is. Tell us about the primary, the congenital one, a little bit about that.
Sure. So there's primary and secondary lymphedema. Primary lymphedema can be at birth. It can show up in puberty age, and it's not exactly so clear.
Is that elephantiasis? Was that one of the?
So elephantiasis is a little bit different. The main cause of lymphedema worldwide is actually filariasis, which is a parasite that in most developed countries, we don't see it in the United States.
In Africa.
Exactly. And that little parasite, essentially a worm, gets into the lymphatic system and just wreaks havoc on your whole lymphatic system. And it's really devastating because those patients in particular don't have access to medical care like we do. And so they're oftentimes in a very late stage, and if you Google, pictures of filariasis, there's really severe pictures online. So that's the most common worldwide. In the United States, as we mentioned, it's mainly breast cancer treatment.
Right. So Erez, if you had to sum up for the person that has lymphedema and they've had breast cancer surgery, what are the 5 things that they should know and do to get best care?
Well, it's a great question. I think, in my opinion, the best thing to do would be treated for breast cancer at a center where the surgeon is aware of the lymphatic system, tells you about it, works with a microsurgeon that treats lymphedema, and there are a number of centers now coming up across the nation. A great resource is the Lymphatic Education and Research Network. Bill Rapici, who runs that organization, is a close friend. And they've done a lot of great work with Kathy Bates to promote knowledge on lymphedema. We recently had a symposium at Harvard called the Harvard Lymphedema Symposium. I was a scientific chair for just last year, which really brings all of these centers together to discuss, the
So where
newest-
do they find these centers? Do they go online? Or?
Yeah, so what I would do is the Lymphatic Education and Research Network, it's lymphaticnetwork.org, actually has a link there that'll show you all the different centers of excellence for lymphedema
All
treatment.
around the U.S.?
All around the U.S. So the ones that come to mind are, Memorial Sloan Kettering, Beth Israel Deaconess in Boston, Stanford has a center as well, USC. There's a number of them, both East Coast, West Coast, and they really do a great job of managing lymphedema and treating it.
Okay, so what other things should they know? So that's in the preventive part. Now, what if they've had the surgery, didn't know about this, and now they have symptoms? What are the key things they need to do now?
So I think the key thing would be really to image yourself. Go to a center where they can look at your lymphatic system and see exactly where you stand in terms of the lymphatic dysfunction. Based on the imaging, it makes things much more clear in terms of how you should be treated, whether you would benefit from a lymph node transfer or not, whether liposuction may be an option. You may not be a surgical candidate. So a lot of these things factor in. Sometimes actually it's not even a lymphatic disruption. Sometimes there can be a different problem, like occlusion of a vein that can cause
something
swelling.
can be easily treated.
Absolutely.
Yeah.
So it's very important to really diagnose it accurately.
So the key things, know before you go to a place that does lymphatic surgery, and if you have it, go to a center of excellence that actually can treat the different options, make the diagnosis of it's early or late,
Exactly.
so you can get the various treatment options. So tell us about your book and this resource that everybody should read on Amazon.
Well, thank you. I think the point of the book really was to educate patients. They've shown that they've done a survey that actually doctors get less than 3 or 4 hours of education on the lymphatic system in their whole medical training.
I think I got less than that when I was
Right, I think so too. I was surprised the number was so high. So I think really the first step is to educate yourself, and that's a great part of what MD Source is, to educate yourself. So you come to your primary care physician or breast surgeon saying, listen, these are the statistics, these are the treatment options. What do you know about this, and how can we work together to make sure that I get the best treatment? So that would be the number one thing to do. And then, being your own advocate is very important today in medicine, and really being educated, and because nobody cares about you more than you.
Right.
And that's the thing to do.
I agree with you, and especially in a disease that most physicians don't know anything about.
Exactly.
So I think this has been, I learned some things about lymphedema because, again, the best informed you gives you better healthcare, and that's you. So, and that's why we're here. So thanks so much, Erez. This was phenomenal, and
thank you.
Good luck in your book and other future books. We'll be having you on again.
Thank you very much, Dr. Work.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.
Wow.